Ever felt dizzy and wondered why? It could very well be due to a condition known as vertigo. Vertigo is not just a simple dizziness. It's an illusion of rotational, linear or tilting movement of oneself or the environment. This sensation can be caused by stimulation of the peripheral, that's our inner ear or central nervous system, which involves our brainstem and cerebellum. It's absolutely crucial to distinguish vertigo from other causes of dizziness, such as cardiovascular, psychiatric, neurological, or aging-related issues. So now that we understand what vertigo is, let's delve deeper into its symptoms. Vertigo can be classified as peripheral or central, each with its unique set of symptoms. Let's delve into these classifications. Beginning with peripheral vertigo, it's typically characterized by a moderate to severe imbalance. Patients often experience severe nausea and vomiting, coupled with common auditory symptoms. Interestingly, neurological symptoms are rare in cases of peripheral vertigo. The body's compensation to this type of vertigo is usually rapid, with nystagmus, the involuntary eye movement, being unidirectional. Switching gears to central vertigo, the imbalance experienced is usually mild to moderate. Nausea and vomiting can vary, while auditory symptoms are seldom encountered. In contrast to peripheral vertigo, neurological symptoms are common in central vertigo. The body's compensation is slow, and the nystagmus is bidirectional. So there you have it. Peripheral and central vertigo, two different types, each with its distinctive set of symptoms. Different types of vertigo, different sets of symptoms. But how do we diagnose these conditions? Diagnosing vertigo involves a careful evaluation of the patient's history. It's a detective work of sorts, piecing together symptoms and events to make a clear picture. Let's delve into some conditions that might be the culprits behind vertigo. First up, we have benign paroxysmal positional vertigo, or BPPV. This condition presents itself as brief episodes of mild to intense dizziness, usually triggered by specific changes in the position of your head. Interestingly, there are no associated hearing losses or tinnitus symptoms. Next, we have Meniere's disease. This condition is a bit trickier, with episodes lasting from minutes to hours. It's often characterized by hearing loss, which can precede an attack, and tinnitus. Some people might also feel a sense of pressure or warmth in their ear. Vestibular neuronitis and labyrinthitis are two other conditions to consider. The former lasts from hours to days with no hearing loss or tinnitus, while the latter is marked by a unilateral hearing loss and a whistling tinnitus, often following an acute middle ear infection. Lastly, we have acoustic neuroma. This is a slow-growing tumor on the nerve that connects your ear to your brain. It's characterized by progressive hearing loss, tinnitus, and often problems with balance. A proper history is the key to diagnosing vertigo. Remember, if you're experiencing dizziness, it's always best to consult with a healthcare professional. Before we continue, we'd like to take a moment to encourage you to join our community. If you're enjoying this content and finding it helpful, why not hit that subscribe button? It's a simple way to support us and ensure you don't miss out on future videos. Give us a thumbs up if you've learned something new today. It really helps us understand what content you find most valuable. We're committed to bringing you more interesting, challenging, and high-quality videos on a wide range of topics, so stay tuned and thank you for your support.